Today we will discuss another 25 most important MCQs for all the government pharmacist examination. Question number 176 is to maximize the first pass effect, which of the following routes should drug to be given? Options are oral, subcutaneous, intramuscular, intravenous. Answer is A, oral. To maximize the first pass effect, oral route should drug to be given. Next question, irritant drug are not given by options are intramuscularly, topically, subcutaneously, intravenously. Answer is B, topically. Next question, drug obtained from plant source. Options are rizorpine, penicillin, ethanol, sulfamethoxazole. Answer is A, rizorpine. Rizorpine is obtained from plant source. Rizorpine is a hypotensive agent. It is used to treat hypertension or high blood pressure. Number question is, the drug is placed under the tongue and allowed to dissolve. This process is called as, options are parenteral administration, oral administration, sublingual administration, intradermal administration. Answer is C, sublingual administration. Next question, which type of force act in drug receptor interaction? Options are covalent, electrostatic, hydrophobic, all of these. Answer is D, all of these. Covalent, electrostatic, hydrophobic force act in drug receptor interaction. Next question, which of the following drug is commonly administered by intranasal route? Intranasal route. Options are insulin, adrenaline, desmopressin, ganirelix. Answer is C, desmopressin. Desmopressin is a drug is commonly administered by intranasal route. Desmopressin nasal spray is used to treat central cranial diabetes insipidus. Desmopressin nasal spray is used to treat central cranial diabetes insipidus, and it is also used to treat nocturnal polyuria. That means frequent urination at night. Next question, major mechanism of transport of drug across biological membrane is by, options are passive diffusion, active transport, endocytosis, facilitated diffusion. Answer is A, passive diffusion. Major mechanism of transport of drug across biological membrane is by passive diffusion. Next question, facilitated diffusion of glucose takes place sites except, options are skeletal muscle, adipose tissue, insulin dependent tissues, renal tubules. Answer is D, renal tubules. Facilitated diffusion of glucose takes place site except renal tubules. Next question, most variable absorption is seen with which route? Options are oral, intramuscular, intravenous, rectal. Answer is A, oral. Most variable absorption is seen with oral route. Next question, the route of administration of vaccine BCG is, options are oral, intramuscular, intravenous, intradermal. Answer is intradermal. Route of administration of vaccine BCG is intradermal. Next question, Default therapy is possible with which route of administration? Options are oral, topical, intravenous, intramuscular. Answer is D, intramuscular. Default therapy is possible with intramuscular route of administration. Next question, polio vaccine can be administered by dash route in newborn. Options are intramuscular, subcutaneous, topical, oral. Answer is A, intramuscular. It is also called IPV, inactivated polio vaccine, and oral polio vaccine is OPV, live attenuated vaccine. Most important question, IPV, OPV. Next question, effect of injecting hypotonic saline intravenously. Options are damage to venous walls, raise in the blood pressure, hemolysis, diuresis. Answer is B, raise in the blood pressure. Next question, which are chemical substances produced by microorganisms? Options are antibiotics, local anesthetics, antihypertensive drugs, antihistaminic agents. Answer is A, antibiotics. Chemical substances produced by microorganisms is antibiotics. Next question, use of isotonic saline do not include. Options are IV injection, intracutaneous injection, subcutaneous injection, injection into varicose veins. Answer is B, intracutaneous injections. Next question, which among the following do not have an active metabolite? Options are morphine, neostigmine, diazepam, digitoxin. Answer is B, neostigmine. Neostigmine do not have an active metabolite. Active metabolite of morphine is glucuronide. Active metabolite diazepam is N-dis-methyl diazepam, or digitoxin. Active metabolite of digitoxin is digoxin. Next question, which of the following routes of drug administration is not parenteral? Options are intravenous, subcutaneous, intradermal, sublingual. Answer is D, sublingual route of administration is not parenteral. Next question, all these drugs are ineffective orally due to liver metabolism except testosterone, insulin, lidocaine, NTG. Answer is D, NTG. Next question, Button's line is a clinical sign found in patients with chronic poisoning of. Options are mercury, lead, bismuth, arsenic. Answer is B, lead. Next question, the pharmacokinetic parameters like distribution and elimination together are called. Options are absorption, excretion, disposition, metabolism. Answer is C, disposition. Next question, what does pharmacokinetics include? Options are pharmacological effect of drugs, unwanted effect of drugs, chemical structure of a medicinal agent, distribution of drugs in the organism. Answer is D, distribution of drugs in the organism. Next question, fast pass metabolism refers to. Options are metabolism of a drug during its fast passage from mouth to esophagus, metabolism of a drug during its passage from the site of absorption into the systemic circulation, metabolism of a drug during when it first comes in contact with gastric juice, metabolism of a drug on the tongue. Answer is B, metabolism of a drug during its passage from the site of absorption into the systemic circulation. Next question, the pharmacokinetic parameter that describes the efficacy of elimination of a drug from the body is. Options are half-life, clearance, excretion, metabolism. Answer is B, clearance. The pharmacokinetic parameter that describes the efficacy of elimination of a drug from the body is clearance. Next question, the fraction of an administered drug that reaches the systemic circulation in unchanged form as given dosage form. Options are bioavailability, therapeutic equivalence, bioequivalence, pharmaceutical alternative. Answer is A, bioavailability. Last question, bioavailability and pharmacokinetic data either is or may be required when pharmaceutical companies submit. Options are new drug application, abbreviated new drug application, supplemental application. Answer is D, new drug application. Bioavailability and pharmacokinetic data either is more may be required when pharmaceutical companies submit new drug application. These 25 questions are most important for all the government pharmacist examination. These questions are also previous year questions. Thank you.